Hi everyone, and welcome to this audio podcast. This audio podcast is part of a Corpuscle Quake, a Corpuscle Quake edition. This audio podcast as part of a Quake and Storm. This audio podcast as part of a Bostic's Quake, and this audio podcast as part of a Storm Bostic's production. In this audio podcast, a bit in around sort of community and point of care testing, or POCT, and POCT. So improved tech sort of has in some ways enabled a range of POCT kits to be made available and accessible to patients and recipients, and this should prompt, for example, scientists to become more active or proactive in across environs. In across environs, increasing the role to monitor suspect and high-risk patients for specific long-term conditions such as CKD. This can include quality assurance, and monitoring specific POCT initiatives. Equally, community pharmacists can have an increasingly clinical role to facilitate better self-care approaches or interventions for patients or recipients in communities under under what had been referred to sort of retrospectively as a service, a sort of an enhanced service under the new pharmacy contract from 2005. Point of care testing results results can be expressed quantitatively, and or sort of semi-quantitatively. But reference values can vary from one laboratory to another laboratory, and it is advisable for service users to compare reference values in which the sample had been taken, or with the laboratory to which a test has been sent for analysis. At the same time, not all laboratory data are direct relevance, but a general knowledge of them is recommended in order to understand a patient's or recipient's a patient or recipient's background. Presently, community pharmacists do offer sort of basic POCT services. However, services should be broadened with the involvement of scientists to interpret results and advise on clinical and advise on sort of laboratory parameters accordingly. And with regard to CKD, scientists and community pharmacists should explore opportunities for collaboration to help increase patient and public knowledge, promote an understanding of in around sort of health promotion aspects around healthcare promotion, and transmit public health messages so that the public become more empowered to take actions which will improve sort of healthcare. Scientists and community pharmacists should also help to target the hard that should also help to to uh, to target the sort of hard to reach sectors of a population not frequently exposed to health promotional activities in other parts in around healthcare, and between healthcare sectors. Point of care testing, or POCT, in community can be utilized to fulfill can be used or utilized to fulfill three main objectives. Number one, to assess the risk of disease. Number two, to screen for the presence of disease. And three, to manage the disease. There is also evidence of how POCT services are expanding are expanding, and of environments where they could be implemented to serve broader communities. Clinical guidelines recommend routine or regular monitoring around renal function in suspected and high-risk patients to ensure that drugs or regimens treatments are prescribed in a safe and effective doses. Dosage adjustment or drugs substitution is often necessary in patients with impaired renal function. Renal impairment is a patient related risk factor for medication related hospital admissions. Both prescription interventions and medicine use reviews allow community pharmacies to provide emphasis on drug formulations to help reduce nephrotoxicity in high risk patients. And monitoring of renal function is recommended on labels of drugs or regimens, but scientists should emphasize that the kidneys are important in around clearance and and the value of clinical or laboratory sort of guidelines. Community pharmacies can contribute to the safer use of medication as a result of clinical and pharmacological knowledge, skills and ability to perform patient assessments and administer drugs and monitor and when relevant adjust drug regimens. Scientists can also contribute to prompt the understanding of screen specific parameters and carry out quality assurance and quality monitoring to ensure accuracy, validity, and reliability in result reporting. However, to do this, they need up-to-date information about patient or recipients in around recipients' renal function. Point of care testing, POCT methods or modalities have become more advanced and can offer the same clinical validity as central laboratory testing if quality issues are guaranteed by trained scientists. It is also available in general practice. It is also available amongst general practice and is considered both acceptable and satisfactory in an environment such as a community pharmacy. That draws this audio podcast to a close. This audio podcast has been part of a Corpuscle Quake edition. This audio podcast has been part of a Quake and Storm, and this audio podcast has been part of a Bostics Quake and a Storm Robotics production.